allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everybody.
Morning.
Nice to see everyone. Call the meeting to order for promotion of agenda approval. Mr. Brennan?
So moved.
I'll second.
Any discussion? All those in favor?
Aye.
Aye.
Opposed? Agenda approved. Minutes from last week's meeting.
I read through them, and I don't see anything that needs corrected. I'll make a motion.
Any discussion? All those in favor?
Aye.
Aye.
Opposed? Minutes approved. Do we have any general public concerns? Any general public out there?
Okay.
Okay. Seeing, hearing none, we will move right along to Michelle. And that is the deal with abatement of taxes from Humboldt County Memorial Hospital.
Yeah. Here's some documentation for you guys.
Let's pass around. some.
Yeah, take one pass around.
You have a copy of this?
No,
Do you want this?
No.
I don't know if she has enough. Make sure you guys
There's
have...
five, and
There's enough.
maybe,
Okay.
obviously, I can pass those through, so. It's yours, Peggy.
I'll put one in Sandy's.
Perfect. So, I'm here as well as Kevin Bornhoff, he's our chair of our board of trustees, and Ashley is our treasurer of our board of trustees. But this is an ask to request tax abatement for the property, on the hospital. So, a little history, when we did our building project, and completed it last year, we purchased the building from Trinity Building Works, which was Trimark Unity Point, which was a tax, entity, basically. They were a for-profit organization. So we purchased that from them, went through the process, but unfortunately when taxes are assessed, it was still obviously a taxable entity, and we are non-tax, obviously we're a county organization. So our request is to have the taxes that are due for the year, $15,798, abated for us at this point.
Michelle, there was a concern brought up, and you kind of touched on it in your explanation, that it was still owned by a taxable entity in 2019, and it's 2019 taxes, correct?
So for 1 month, July 1 to July 31st, it was owned by a taxable entity. That is correct. August 1st of 2019, we own it.
You had the hospital purchased it.
Yep, exactly. So there is 1 month there.
And Eric, your question, so you can kind of see on that information that she gave you. So it's assessed on January 1 of every year, which on January 1 of 19, it was taxable entity. But this covers the period July 1st of 2019 through June 30th of 2020.
I don't think I give them all.
No, well, that's okay, go ahead.
Yeah,
Sure.
Is it on there?
yes, it is.
Okay. So,
It's right here where it covers July
All right.
1st.
This is a condensed form, that's even better.
sorry.
All right.
I tried
July,
to make it simple, sorry.
I like that.
so that's what Michelle was touching on, that July
Uh-huh.
1st of 2019 through August 1st, it would have been taxable for that month. And then when the hospital took possession, August 1, then they're a non-taxable entity. But from July 1st through August 1st, yes, it was owned by a taxable entity for that period.
So, did you guys get that money when you bought the property?
So,
That month of taxes?
So there was a traditional tax proration, which was
Yeah.
397 days, and that would have covered the taxes of July 1st, 2018 through closing August 1st, 2019. So they did pay a tax proration for
Oh, okay.
the owed, but they didn't, and they shouldn't have had to pay beyond when they sold it. So they
Right.
paid their tax proration through the date of closing, which was August 1st, 2019. And then after that point, the hospital owns it,
Yeah,
and they're would be non-tax exempt.
yeah. So the taxes for that month got paid by the seller, basically, is what you're telling me. Is that, did I hear that right? Linda?
They get exempt.
Well, the assessment's made for January 1st, and anything, if that would've been transferred before July 1st, it would've went to exempt.
Mm-hmm.
There's taxes due for the year 2019, the whole tax is due by somebody. So, and those taxes go to different entities, it goes to the hospital, to the schools, to the county, to, you know, so, and I think Janet Ratliff can explain
Yeah, she,
what it
Jana,
covers.
Jana,
Yep.
and I don't, I mean, not the treasurer, obviously, and don't quite understand the correlation, how that works, Ashley.
Sure, so in Iowa, we are a year, as you may know, we're a year in arrears of property taxes. So when you go as a seller to sell a property, you're responsible not only for the current taxes on the property, but for approximately a year's worth, which is prorated through the date of possession.
By the day.
Yep, by the day. So when they sold it to the hospital, they had a tax proration of 397 days through the date of possession, which was August 1st. And they did pay that. That was paid just as it always would be. If you were selling a house, if you were selling farmland, same thing.
The sellers, this,
Yep.
Trinity Building Corporation.
Yep. Mhm.
But you said the sellers paid it to the hospital, they didn't pay it to the assessor.
There's a credit for it, yeah, a credit shown.
Yeah,
But that's only through August 1st of 2019. This tax that we have now is from July 1st through 2019, which I don't think we dispute that first month. But then from August 1st through June 30th, it would cover that period through 2020. And that's what the hospital is being taxed on.
So they paid you, close to half of the taxes.
No, they paid the taxes full. They paid everything that they would have owed through the date of possession. But the hospital's they're having a tax from August 1st on, July 30th on.
So last year, we paid $14,708. That would have been the previous
The
year.
18 assessment.
Yep,
So now the 19 assessment is due, and that's 16,000
yeah.
something.
We're just looking for some clarification.
Yeah.
We figured since you're the one that handles the taxes, you might be able to provide that.
Talking about what it covers, and I don't...
This is your sheet.
Yep, so it's from the assessment of the property of January of 19. So that's what, the building was there, January 1st of 19. And then they pay that in what now is September of 20 and March of 21. And then, like she's saying, the fiscal period, or the actual tax then is from July of 19 to June of 20. But the process always is the same. Your value is what says of January 1st of the preceding year, and then the tax follows through, just because it takes the time for it to get from her office, through the auditor's office, to our office, to collect. The assessment that they paid last year was when the clinic owned it, correct? You didn't own it yet.
Correct.
And then this assessment is now in the hospital's name, which they're exempt, but the clinic wasn't.
mhm.
That's why the tax follows through.
I mean, it's really, to me, you're making it sound really difficult. I mean, when somebody sells a property, they pay the taxes to the buyer, typically, then it's the buyer's responsibility to pay those taxes to that date. So what are you disputing?
We are a tax exempt organization.
I know, but you still have to pay that money that, when it wasn't your property, to that date.
So that has been paid.
That has been paid?
Yeah.
So then what's the you say it hasn't been paid?
Last for the 19, no.
So the issue is we were assessed in 2019, January 1st of 2019, Trinity Building Corporation owned it as a taxable entity when it was valued, right? So that's a taxable organization that's gonna get full year of taxes.
Mm-hmm,
We purchased it mid-year,
yeah.
and now we're getting these assessed taxes, which...
And you collected the money from that seller,
They got the prorated amount.
Yeah.
Which was from July 1 to whatever date they took ownership, and unfortunately...
oh, okay, I think I'm getting it now. You're thinking you're being assessed from the selling date to the end of the year?
we're getting it for a full year, from July 1 of 2019 to June of 2020.
mhm,
Humboldt Hospital owned that starting August 1.
of 19,
11 months of this.
of 19, August 1 of 19.
Yeah, so 11 months of this, a tax exempt organization owned it. So we're asking for that to be abated. We'll still pay the 1 month when it was an actual tax, a tax entity that owned it.
They're kind of getting hit doubly. So the tax proration that would have occurred at the closing for the
Mhm.
taxes that were owed through the time of closing by Trinity, that would have been for 18 and then a few extra days. That's why we get to the 397 days, based on how the tax proration occurred. The taxes that would have run from June of 19 through July of 19 through June of this year would have been based on January 1st of last year, which at that time was a taxable entity. Just because of when the hospital closed on the property, they're basically getting now another approximate year's worth of taxes that they have to pay, which they're tax exempt.
And that's the way it always works. But if you look at, say it went the other way around, how would you handle it? Say the hospital sold it to the clinic, would you go back in and charge the clinic for your taxes? If they would not owe taxes, because the hospital was exempt.
Exactly.
So it's just the way it flows, unfortunately.
And the reason that this, that's exactly right, and that's just how the Iowa Code is set out, but the Iowa Code does allow for this abatement for these sort of circumstances, and so that's that code section that's there. When it does fall like that, where property closes in the middle of the year, and otherwise would have been exempt, the Iowa Code allows for there to be an abatement at your discretion.
Mhm.
427.3.
Okay. Our office goes, Iowa law is that anything that is taxable January 1st is assessed as taxable. If it goes to exempt prior to July 1st, then we change it to exempt. If it goes to exempt after July 1st, it stays taxable, and those taxes have to be figured out between the buyer and the seller. And they're all due. And they also signed a business property tax exemption on 12/26/19. So they knew that, it was taxable, and you guys said that, so. And I don't care what you do with it, I'm just telling you what our stance is on it, and that how we have to treat it in our office, so.
In theory, if they had closed on, say, June 30th instead of August 1st, they wouldn't have owed anything.
Mhm.
Clear as mud.
Yeah, it is.
Yep.
Just a second, what, Sandy?
There said there could be an abatement. Isn't there something, I thought I heard somebody say that there was a law, though, that kind of talks to this kind of situation where they can be an abatement that can be voted on and chose if that's what they decide?
As supervisors, you have that right, yes,
I
that's
think the
responsibility
nonprofit,
option.
no nonprofits are taxed. No one wants to lose tax rate, I really, I feel, that's a lot of money for the county to lose, but still, what's fair is fair, the nonprofit's a nonprofit.
Is it correct from the treasurer's office standpoint, that it should be not clear as mud, but just clear? Is it?
Just follow the process.
It makes sense, and you have no
Follow the
dispute
process.
of this abatement?
That's your guys' issue. I told them I don't have the right to.
Right.
Yeah.
Okay, but
I just don't wanna cause a ton of problems down the road by doing this, and then all of a sudden, well, geez,
Everybody's getting their taxes paid.
yeah. 'Cause this only applies to nonprofits, this down here.
Well, the code, the way I
If it's a nonprofit, how
understand.
can anybody else come in unless they're approved as nonprofit? They have to go through the steps to become a nonprofit. Not just anybody who's just come in and say, oh, I'm a nonprofit, I want to have my taxes.
Right.
Mhm.
Yeah.
Back in in 2018, Cherokee County Board of Supervisors, just as a point of reference, they had a similar situation where the city purchased land property in the middle of the year and asked for a little over $2 million to be, of the 5 properties that were purchased, to be tax exempt, and that their supervisors approved that in this very similar situation. So, unique, but it could happen again, you know, with the city buying something, or the county even choosing to buy something that's currently taxed. It's not,
One other thing I guess I would just add is that the hospital, I think we're coming to and just respectfully asking for your consideration.
Mhm.
I mean, the hospital, we depend very much on the county, and so we don't want that to appear as though we do not, we are very much dependent on them, and just a respectful request is the staff for consideration.
I mean, I have no problem with it. I just don't wanna cause a problem down the road. Because sometimes you make a decision and you think it comes back and bites you in other situations. So, and this is unusual.
Sandy makes a good point, though, obviously, it's only tax exempt, so it has to be the hospital.
A nonprofit.
The nonprofit.
Mm-hmm.
I make the motion that we abate the taxes.
All but 1 month?
Yeah, how about 1 month? Sorry about that, I forgot about the July talk.
I'll second that motion. All right, we have first and a second, any further discussion on that? All those in favor?
Aye.
Aye.
Opposed? Forgiven.
Don't need to resend the statement, and,
that would be great.
Abated, I guess is the right...
and we're gonna just make it a flat month, right, the way that...
Yeah,
we don't have to
that'd be fine.
or anything.
Just 1 month.
Okay.
All right.
Thank you, guys.
Thank you, Michelle. Thanks, Ashley.
Thank you. Can I answer any questions about life and COVID while I'm here?
Do you have any answers?
No.
Is there anything appreciably different? Because, you know, we're always bombarded on the news, it's apocalyptic, of course it has been, but is it, the hospital standpoint wise, is it anything appreciably different recently?
We're definitely seeing an increase in cases, which is leading to more hospitalizations, more access issues to the clinic.
Supply issues, do you have any supply issues?
We're doing well. You know, there's always gloves right now are the issue. So, it just varies from time to time, but between our suppliers and our network system, we're safe today.
Okay.
And then from a rapid testing perspective, we're pretty much able to test everybody as a rapid test as long as you're symptomatic and see a provider. We've been able to secure a couple of contracts to get testing, so that's been up and down, but right now we're in a good place.
Okay.
Working very closely with the schools as well to make sure we're all doing the right thing, and not a lot has changed.
Yes.
Guidelines change for close contact.
So as of 8 o'clock this morning, Iowa Department of Public Health has not issued their opinion of that. The CDC did change their guidelines to, before it was 15 minutes consecutive, that was an exposure for quarantine. We in Iowa today, it's 15 minutes consecutive. The guidelines changed to be over a 24-hour period. Any time over that time, if it added up to 15 minutes, would be considered an exposure. So when you're doing contract tracing, you can imagine how big of a...
That just made it a lot bigger.
Yeah, and we in Humboldt County, our public health continues to do its own contract tracing. There's only about 50 counties left that are doing it. It's just so much work, they've handed it over to the state. So we want to keep doing it, because we know real time what's happening in Humboldt County. But the Iowa Department of Public Health today has not made that change, so they are evaluating it and they'll make the determination. So we're still acting on the old, which is it has to be 15 minutes within 6 feet to be a true exposure. If you're, it depends on the situation, but.
So from the beginning, what year this started, I can't even remember when it started, we were doing X amount of tests versus what we're doing now. How many tests have we in?
I don't have that in front of me.
I mean, just a guesstimate, were we
We're doing
doing
like
10?
3 times as many testing now as we did in the beginning, or half as much,
So,
or...
yeah, we're probably doing about 20 tests a day right now, on average, in Humboldt. That doesn't mean Humboldt County residents aren't getting
Sure.
tested elsewhere. In Humboldt, we're doing about 20 a day. It's not fair to say we were only doing 2 before, because we only had access to about 2 kits when it
Well, that's why,
came out.
That's what I
I guess
wondered.
that was my point. We only had so many that we could use, so
Yeah.
we were,
Very limited.
and the numbers, when we were testing more people, you're gonna get more positives.
Yeah.
We all wish it'd go away, but
March 12th is the date it started. I know that. That's a date I'll never forget.
Okay.
Yeah.
well, keep up the work, all we,
Go ahead, Sandy.
Are the hospitals, are you overloaded, or are the beds pretty full, or how are you coming as far as that part goes?
We've been busier than we've ever been. You know, we're licensed at 21 beds. We start bunking patients at about 12 patients. In the last 6 weeks, we've been at that capacity. So normally we run a census of 6, and we've been running close to 9 to 12 patients in the last 6 weeks. So, doesn't mean they're all COVID. It's just there are sicker people today, right now. And this isn't normally where we see that peak yet.
Yeah, normally your flu is a little later on, after Thanksgiving and Christmas.
We are seeing influenza and COVID both being diagnosed together, so it's here.
and at least the surgery stuff is restarted, and they're going through all of the particular tests and whatnot in order to have all that done, so...
Yes. From a hospital financial perspective...
Things are better.
Things are good. We did receive funding from HHS and from Medicare, and, you know, we're working through what that means to help us sustain where we're at, and also prepare and kind of continue to plan and respond to what's going on. So that's kind of our conversations today. But yeah, we're busier than we've been in a very long time right now. I think the message that the medical community is trying to get out to people is, please, if you're a chronic disease or a vulnerable population, please continue to come in and be seen. That's what we're starting to see right now, is those folks that didn't come in when they should have, are starting to have some adverse reactions to that, so.
Okay.
That's the message.
Thank you.
Yeah.
That's a nice update, but it's not so good news.
Please call if you need anything. Obviously, we all work under one roof with public health in the hospital, so we're all in this together, and if you need questions answered, we're happy to do that.
Okay.
Thank you.
Very good, thank you, everybody. Ken?
Been 15 minutes, should I leave?
Probably.
I'm gonna get away from you, I'm 6 feet of distance.
I just have the one official thing on the agenda, and that's to approve pay voucher number 1 for project LC 170604 PCI. This is the box culvert that they installed on States Avenue just south of Highway 3. The total is $139,153.84. This is everything but the retainage.
Yeah, they come in and crank that out quick and got their bill out. Okay, I'll make a motion for pay voucher number 1 to PCI for the amount of $139,153.84.
I'll second that motion.
Any further discussion? All those in favor?
Aye.
Opposed? Approved.
The unofficial item that I guess I bring before you guys today is, we made it through the first cut on the build grant for the potential Murray Bridge replacement. I imagine there'll be 1 or 2 more waves of cuts before everything's said and done. But one of the questions that they've subsequently come out with is, would the county still be interested in this bridge project if they weren't eligible for full funding, which I believe it's 75-25 is what they're proposing. But if for some reason they could only fund 50% of the project, would the county still be interested in doing? And my opinion is yes, but I figured I'd bring it to you guys. So if this project costs $3 million and the feds kick in $1.5 million, that leaves $1.5 million for us. My HPP money is pretty much tied up, but like farm to market wise, if we're looking at putting it on a new alignment and doing grading, I can request to the farm to market board that they change the route, and then I would have that additional funding available. So you figure if that's $800,000 to $1 million to grade that road, you know, then you're only looking at coming up with $500,000 of local money.
Yeah, that'd be a good project for $500,000.
I've got reserve money set aside, so.
Yeah, I'd say move forward with it.
Okay.
That's my opinion.
I've got to formulate my response for all of these. I just wanted the board's direction if, you know, if we can get that bridge done and it's only costing $500,000 in local money, I think it's.
Go for it.
Yeah, 'cause it's a long drive around.
Yeah, it's a minimum of 10 miles
Mhm.
to go to Rutland. It's 12 if you go around the other way.
Yeah.
I will get that response out this week then.
I heard that we live on a straight and left road up then.
What I'd like to do, or what I've proposed to the state, is that Elm Avenue would be a through road now on the new alignment, and we would abandon the road that's falling into the river by Tim Goodwin's house, and we would remove the bridge from its current location right now. I've talked with Midland Power. They have the overhead lines that run across the river right there. His preliminary quote to move the utilities was about $100,000, but he's going to a meeting this week, because I asked him, and I said, we need a little friends and family discount here. You know, you guys are gonna have better access.
Yeah, they have much better access to their lines.
Because right now, they've got no access to anything over the river. I said, we can look at, adding conduit to the bridge so that your utility can run with the bridge. We can look at adding a lot of things. So he's supposed to be having a meeting with some of his superiors to come back with a better price of what it would cost. I have phase one archaeology coming in from Des Moines. They have to basically go dig a few holes in the ground and shake them for Indian bones or Indian heads, whatever. That's part of the cultural evaluation.
Anything that's built has to have that.
Anything where we're looking at buying right away and relocating a bridge, they have to go in and do that, and then give their recommendation. Would be for NEPA and SHPO clearance, which is like state historical preservation. I don't anticipate anything. They didn't do their, but we still have to go through it.
Yeah. Nobody used to live in them swampy bottom grounds. It's usually the bluffs.
They said that, some old maps from the 1800s show, potential burial site somewhere within a mile, so they have to.
Right. We gotta jump through the hoops.
Yeah, as per protocol. Well, keep working on it, sounds like you're on the right track, and you got the go-ahead.
Okay. Sounds good.
Did you say remove the old bridge? Was that what I heard? or-
Yeah, we would remove it. I know some counties have picked them up and moved them to parks. I don't know if that's something that Todd would be interested in. I can touch base with him.
There's a lot of people that fish off that bridge. Okay.
Keep chewing through it.
Thanks.
Thanks, Ben.
Thank you, Ben.
We have, Randy, here with, a little bit of information for us.
Dave, would you keep two and pass the rest?
I'm gonna put one in Sandy's.
Well, I passed around, you don't need to sign. I'll pass, Dave has one that we'll have everybody sign. This was the rezoning of the dual property. And I emailed everybody, and we had the vote returned on that, and it was unanimous. That was a property changing from agricultural one to residential R1. I have the permit completed, all requirements for residential according to the zoning ordinance have been met. The reason I emailed is requested to get it started as soon as possible. Everybody always wants it, a month before yesterday, and so if I could have Dave, please, just mark that. That one sheet will be then placed in record, so we just have to do it on one page.
Okay.
If that would be okay. That's how I set it up anyway. So, and I let them know that, the email indicated that it was unanimous. Anybody have any questions on that one? Got a couple other items.
Sandy was here.
Sandy, is it all right if he stamps it with your approval? I see you voted yes.
Yes, I did, yes, me.
Okay.
Oh,
Okay. I thought I'd give you a little bit of an update on our process of looking at the zoning ordinance. We met, and I think I sent out a notice or email on it, Board of Adjustments and the zoning board.
Do we need to vote on it or not?
I was gonna say,
We've already
do we need
voted,
action on
It's
that?
already been-
we voted,
But it wasn't
Like,
an official meeting.
Okay.
Do you wanna accept the recommendation, or?
let's,
I'll make a recommendation, or...
Okay, look, Sandy already did. Okay, so I have a first.
You can second it.
I'll second it.
okay, so I have a first and a second on that. Any further discussion? All those in favor?
Aye.
Opposed? Officially passed.
Thank you.
on the record.
Thank you, Becky.
Yep.
Okay, back to what I was saying, the Board of Adjustments and the zoning board, we had a joint meeting, we had people from both boards, and we also had Greg Stogie met with us as well, and we looked at some of the items that we have found, and I have found, as far as being, I won't say, real problems, but things as far as we looking at, is there a need for rewriting the zoning ordinance or revising? And I've been doing some research since that meeting as they requested. I've talked with, I think it's Shirley from Midas, got some information, valuable information sent from her. I haven't gone through all of it yet, but I think it'll be extremely helpful. I'm looking also at some of the zoning ordinances from back when ours was written. Many of them were written in other counties similar to ours as kind of just a template. And she indicated that many of those have now been changed by other counties, maybe using even some other formats. And so I'm looking into what is common, what might be available, and I will make these recommendations, or at least explanations to another joint meeting of both boards, along with also methods and possibly costs on as we've talked about many times, zoning maps. And so I'm gaining information from that. I also participated in a workshop from Iowa State Extension dealing with planning and zoning. And so all of those things are going into the process of accumulating research to make more information available to both boards. My goal would be that by the end of November, I would have that research completed and have a zoning board and Board of Adjustments joint meeting again to look at those things, and hopefully by sometime the first of the year, those two boards together, going through the zoning board as they are the recommending board to the Board of Supervisors, to come up with some recommendations of where we go from there. I think from what I can see so far, and it seems to me that there probably needs to be at least some revisions. Right now, the ordinance has amendments to it, and one of the things we talked about was to try to streamline that process, since it's been so long since the ordinance has been looked at, is looking at how can we infuse some of those amendments into the ordinance itself, and then possibly putting a timeline on having the ordinance reviewed every so many years, so that if there are any amendments that take place within those few years, they could possibly then be infused at each review. I think that would be helpful, because it's been so many years since this ordinance was written, many changes, and obviously taking place with amendments, but I think it should be probably looked at more often. I believe it was 1996 when that was written, and so...
We currently have a policy where every 5 years we recodify our ordinances.
Right.
So anytime we've had a zoning person, I've asked them to take a look at this, but nobody's ever addressed it. So it has been at least addressed every 5 years.
Right. And
Just
that
to
would
give you
be...
a time frame anyway.
That would be extremely helpful for everybody. My goal would be to be able to provide for all of the administrative offices, all of the boards, the same information. Because it appears to me, from my experience so far, that sometimes the right hand doesn't know what the left hand is doing, or even what should be done. And so, I would hope that we would be able to improve that. So then, every 5 years, it wouldn't be such an astronomical, undertaking to look at that. So, again, my hope is that by the end of the year, there will be some things that will be addressed and go through those joint meetings of the boards, and then sometime at the beginning of the year, those things would be put into a recommendation coming to the Board of Supervisors. Any question on that? The last item that I would have is, we've talked about, we have a vacancy in the zoning board, and membership there, and the ordinance is quite vague. All it says is, those members will be appointed by the Board of Supervisors. It doesn't say anything about a process, and I'm thinking, okay, how should we go about that? Recommendations from, I know we've talked about recommendations from the Board of Supervisors, but there's nothing in there that says, okay, how do we do it? Let's say you have 3 people that are interested. How do you go about taking care of that? And so I'm just throwing that out as some direction, because I would really like to have, if we have a person, I'd like to have that person involved in what we're doing as far as the other things we already talked about. So I'm open to anything, however you want to do it, or however you want me to do it, or together. But we talked about it a couple times and really haven't come up with a member, so to speak, so far.
If we had 3 people that were interested, I'd hire or get all 3 of them to be on board. Usually you'll have 3, and then it'll go from 3 to maybe back to 1.
Right.
I did visit with one gentleman and asked him if he'd be interested, and he is a retired farmer, but he always goes and helps farm, and I think they probably are done, but I didn't know how to proceed either. I didn't know whether to give him Randy's name, or bring the name to you guys, so that we could, talk to him about it, or if he'd just tell me to forget it. I gave him the information that Peggy wrote up for what their job description was, and I've seen him a couple times since, and he hasn't said, no, I don't want anything to do with it, so...
Boy, I think we should push that avenue.
Yep.
You got somebody that's interested.
Well, there's two sides to it, the way I look at it from my viewpoint. You can have, you know, like one person like that, and they say no, or yes, or whatever, but what if there are 3 people that are recommended? And we contact all 3 of them, and they all say yes, now what do you do?
Mhm.
It would be the board's
You
decision.
say, no, we don't need you now, or, you know...
Then you might have to go through the interview process. Just
Yeah.
like-
Yeah, like we do with everything else.
And who else, who does that? See?
The supervisors do that,
Yeah.
make that decision.
Well,
Is there
so-
a quantity of people that you have to have on the board? I mean, is it so that you can only have a max, or you have as many as you want?
5.
Max of
There
five.
is a max.
Yeah.
Well, I believe so, but I'd have to check that for sure.
We're thinking 5, Sandy.
Okay.
I would not have any opposition to having more.
What about if you're looking for somebody, why can't we put it on our website, and post it just like we would almost like any other position? And see what you would get for, so that might
We
make it
could get some
interesting.
candidates.
Yeah.
I would say Bruce brought up a good point. If you had someone interested and wanted the job description, it wouldn't be a bad idea to have them contact Randy, because he could, obviously has worked with this now for a couple of years, explain
What's
the
involved.
process. And that would maybe help them in their decision. I mean, obviously, the board doesn't meet every week, and
Right, it's,
you,
What, about once a month?
yeah, it has been, maybe.
so I mean...
It kind of depends on what comes before that
Right.
board. And so, it's not like it's a huge commitment, but it is a commitment.
It is, and
That is important.
that's what you want any candidate to be understanding of,
Yeah.
so that they know it is, you know, what it is.
Right.
So I don't think...
Well, if you're okay, Randy, I can give this gentleman your phone number
Absolutely.
and say, talk with Randy. He can give you a little more update as to how it works.
Right.
And if you're interested, then come back, you can come back to the board and say, I visited with him. Or, and if we put it on the website, I don't have a problem. We get a couple of people that are interested,
We get interview.
yeah.
I didn't want to do something on my own that would
No.
not, because it just doesn't really say the procedure for that.
Mhm.
I mean,
Yeah.
maybe it should, and that might be one of the things that we need to have a revision in the ordinance. This is what the process is going to be, and not only for that, but also any of the boards that deal in the position.
Okay.
Good work on that. Good questions.
Yeah, well, I would, like I said, I would just like to have that person, if they're available, to be involved in what we're doing on the other stuff, so.
Yes.
Mhm.
Hopefully.
Just make sure when you do that process, you follow whatever Iowa code says on the appointment of members to the zoning board, because you do have to comply with that.
Yeah.
Excellent. Good. Thanks. That cover all the, looks like you covered it. Thanks, Randy. Thank you very much. If you don't mind, I think in essence of time, can we drop down and approve the claims at this point?
I looked through, the general was, the number I had was 317,556.39, and drainage was $19,020.98.
That's what I got, I'll second it. Any further discussion? All those in favor?
Aye.
Opposed? Approved. Okay. Now, we have, discussion on the invoices for the general obligation bond proceeds.
We touched on this a little bit earlier in the week. The fire department would like to know what type of invoice or billing or whatever you wanna call it, requesting the money, their share from the GO bond money that will probably take place sometime in November. They're wanting to know, do they need a billing from each city saying, okay, here's what our city purchased, here's what our grant money is coming off of it, here's what we're requesting from you? Or do they do one total billing saying, here's the total, take off the grant money, here's the end product? They just wanna know how to bill us so that they're ready when the time comes and they can go ahead and get their equipment.
Mhm.
Okay, thank you.
Are you talking to somebody outside?
Yes, the restrooms were
I
closed.
thought when we were at that meeting, it wasn't it like, okay, they were gonna have, whatever their grant money was, they had to pay that directly to whoever the provider is, they're buying the equipment from, and then the county was gonna pick up the rest, correct?
That's the way I understood it, Sandy,
That's the way I understood it.
and I,
Wouldn't they just invoice, I mean, unless they wanted, how do we have to, for the grant money, do we have to show that we paid it? So would we pay the remainder? I guess it kinda depends what's the ruling on that, on the bond, how we have to, I guess we get a grant, but I mean, on the bond, how do we have to prove payment? Does that have to be taken into consideration?
I don't believe there's anything on the bond that says how we distribute the money.
Okay.
But it is on their grant.
But it is on their
Their
grant.
grant has to be spent the way that it was assigned to them to be spent.
Correct.
Yeah.
So, that's the way I assume.
I would say they spend their grant money and bill us for the remainder, each entity.
Yeah, each city or
That's
entity.
what I was thinking. I agree.
Because their grant money is all different for every city.
Yep.
One of them gets 70%, the other one gets 15%.
Right.
Yeah.
Yep, that is correct.
All right, and do you need to see that separated out on a billing? Or-
Yes.
Or do you not care, you just want a total saying? the
No.
total? I mean, I thought it'd be a good paper trail.
Yes, it
I
would.
would, I think so
Like
too.
Dave said,
Dave.
it varies from entity to entity. The only other question that, with this grant business, does anyone know, sometimes you need to pay the entire bill before you get the grant money.
I'm not sure on
They're
that.
just giving
I'm not
so
either.
much money.
That's
From
why
what I
I'm-
understand, they're giving so much money, and that's just it, they're giving the money for that, and then they have to prove that they, and then they have to pay it to that, equipment person or company or whatever, and that's how that, from what I understand, that's how that went. Well, I think we would want an invoice to show breakdown, okay, this
Yeah.
is the total amount for this entity. They got this much grant money, and then the council needs to pay this much. I think we need to have it broken out.
Right, but I guess, I'm sure you follow my question.
Yes, I know what you're saying.
Well,
A lot of places have to, you gotta give the grant company a paid receipt to get the money.
Bingo.
Yeah,
But I don't know if this is that way.
I'm not sure.
I mean, that would be the city's
Yeah.
responsibility to decide that, to find out, that would make a difference in their request.
Right.
Where they may need the entire amount of money.
Up front.
And then that grant money, I would suspect then, if that was the case, would be paid back towards the bond.
But still, we'd like to see it broke down by entity.
Yes.
So-
When Sandy and I met with them out there that night, the way they talked was, they get the grant money, and they have to send that right to the engineer and company that's getting the radios and the equipment. And then the excess, then they bill us for, and we pay them out of that grant.
Okay.
If I understood it right.
Pay from the
That's the
bond.
way I understood it, too, David. Yep, that's right.
If that's the case, that's all fine, but I think the discussion of the breakdown of
Yeah.
these dollars per entity is good. And the cities or the departments in the cities need to find out what their procedure is, their payments.
Mhm.
Mhm.
But each entity is gonna have to send us the request.
Yep.
Correct.
Because, like I say, I think Humboldt got like 15 or 17% or something of the kind, and some of the smaller towns, there was 2 of them that didn't get anything, and
Yeah.
there was a couple, 3 of the others that got like 70% or something, you know.
Right.
it was way up there.
So we do need to see the breakdown of the dollars,
Right.
the grant money versus the balance.
Mhm.
Correct. Peggy, do we have to make a motion for that?
No, I just needed some guidance to tell Jim.
Anything else on the bond process? Just that one I know
Good.
we've talked
Should be
about.
closing sometime this week, so,
Yeah, hopefully.
mhm. That's
Good.
what their initial was, that they would do that either the
Mhm.
29th or the 30th of this month.
Okay? Anybody got anything else on that? All right, next item, we do need to approve the transfer from the city of Pioneer warning siren to the city of Livermore.
It's non-working.
What's that, they found out it didn't work?
It's non-working right now.
Oh, yes,
They don't-
currently, yes. Oh, okay. Yeah, I know we discussed this last week, and, I'll make a motion to, transfer the warning siren from Pioneer to the city of Livermore at no charge.
I'll second it.
Any further discussion?
Like I say, we're giving them, we're not paying the bill to,
No,
they're
okay, that they can have it and deal with it.
yeah, that's, I wanna make sure that's clear.
Yeah, there's not, we're not paying for,
A working siren,
yeah,
We're
it's
giving-
theirs to get to work,
yes,
but they sure can have it to work.
yeah.
Good, any further discussion? All those in favor?
Aye.
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 Opposed? Transferred. All right, approval of hazardous pay for election officials for the upcoming general election.
I am here again to ask, since we are still in the middle of a pandemic and the numbers are up, that we approve the additional $4 per hour hazard pay for election officials like we did for the local option sales tax and the primary.
And I do believe you have acquired funding for that too.
I do have some grant money that'll cover that additional.
So I'll make a motion to approve of hazard pay for election officials for the general election of $4.
I'll second.
Sandy got it.
Okay, we have first, second from Sandy, any further discussion on that? All those in favor?
Aye.
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 Opposed? Approved.
Along those same lines, I was also able to secure a contract with Servpro, and the day after the election, they will go in and disinfect and clean all of our polling places.
Oh, nice.
We are very fortunate to have different entities within the whole county that let us use their buildings at no charge. I feel like the least we can do is give it back to them in as good a shape it was before, maybe in better shape even, I don't know
Yeah.
how they're cleaning and disinfecting at their places. But, they will be in good shape so that they don't have to worry about any residual germs or anything left there, so.
Yeah.
Excellent.
Thank you, that's good.
Yeah, that's very good.
Good
And
thinking
that grant
there.
money will cover that also.
Okay.
Excellent.
That's
Yeah.
awesome.
Thanks.
Anything else election related?
No?
You're getting a lot of, absentee, ballots there.
Yes, we're over 2,300 now, which is a new all-time high for us.
And we're having lots of early voting too, right?
Lots of early voting in the office. One day, we had almost 70 people, just in one day, come through. That's been our highest so far, so.
Yeah. It's hard to get work done then too, isn't it?
Saturday.
We had 20 on Saturday. It wasn't quite as busy as we thought it would be, but weekends are different. People have things to do with family, people stay home. It wasn't,
Watch the snowfall.
the best day, yeah, exactly.
That was Sunday, yeah.
Saturday was,
But it did help us to get some other things done in the office, because we're a little bit behind on getting some things ready for this election, so it does help to do that, and that's a good thing.
Yep, but it was time well spent then.
Most definitely, most definitely. Did want to reiterate to the people that live in Thor, there is no longer a polling place in Thor for this election. They're going to need to come into Dakota City and vote at the VFW. And, the only other places, Bode, it's not in City Hall, it's in the community center in the back of the same building. Otherwise, our polling places, Humboldt, City of Humboldt, instead of voting at City Hall, if that's your usual polling place, you're gonna go to the, community center, which was the old Senior Citizen Center, but now it's called the Community Center. So we will have signs up and around redirecting people. We do have things in the newspaper and the reminder coming out. Kent, I'm hoping will put something in the newspaper also. We're doing the best we can. Some of the cities have already said that they're gonna post something on their, Facebook pages and they're gonna post it in the newsletters that they have them sending out to go, to their community, so people know where to go. So it's been a good cooperative effort. I have to thank all the people who have volunteered to work for this election. This is the first time I have had so many people volunteer to help in any way whatsoever. Not just at the polls, it's like if you need me, just to disinfect things, if you need me just to come up and help sort things, or put things away, or haul bags, or whatever you need, I'm here. And it's excellent, it's very nice to see that.
Yeah. Well,
Yeah. And if we haven't been able to use you, it's not that we don't want you, you'll still be on the list and we'll use you in the future, it's just that we have so many good people working this time, and I have to use a mix of parties with this election for a general. You have to have so many Republicans, so many Democrats, and then you have to make sure you have seasoned people working as well as some of the new ones, because you can't have a whole brand-new board
that don't know
with
what's going on.
that don't know what they're doing, yes. You have to have some seasoned people on there. So when you do that mix, it leaves out some of the new people, but that's not intentional, it's just, that's how it works out. So we're trying to work, this election's gonna see a lot of new people, but we'll see, and we're doing our first ever, shift split in the city of Bode. They had enough volunteers there that their first shift is gonna work 6 to 2, and the second shift's gonna work 2 to 10, but the chairperson will be the constant all the way through there. That person will stay all day long.
okay.
So, and then the people that are on those shifts have worked at least one other election before, so they have some experience.
No, that's good.
So, we'll see how that goes.
It just proves that the whole community is just an awesome county,
Yeah.
and that everybody...
They come out when you need help, they show up.
They do. The city of Bode actually went out and talked to people and had names for me of people who'd be willing to do a split shift, because they asked me at the local option if they could do this, and I said, the reason we don't do it is because you have to have technically 2 boards.
Mhm.
And if I don't have any people, if I have trouble finding people in your community, how am I gonna do 2 boards? So they actually went out and asked people, and got me names, and I thank them very much for that. So we'll see how this goes. Maybe it'll be something we'll do more often in the future, maybe not, we'll
Yeah.
see how it works out.
Awesome, good.
Great.
Thanks for the update on the polling places.
You're welcome.
That was my question, well answered. And thanks again to all the people that volunteered to make this work, and it's a bright spot in the midst of everything else that's going on.
You bet.
Mhm.
And we truly have some excellent election officials out there. So please, when people go vote, be kind to your election officials. It's gonna be a very busy election. It's a long day for them. If you have to wait a little bit, please be patient. They're doing the best that they can.
Even though they know you personally, they still have to ask you for your ID.
Exactly. There are steps that they have to go through, whether you like it or not, they're required to. They can't make it go any faster. I mean, until they complete the one step on the precinct atlas, they can't go to the next and get you on your way. So, I'm hoping for no major issues in that area.
They do it to all of us. My neighbor asks me every time for my license.
Yeah, every time.
So, I think she does it just to make me a little growly, but she does it.
Yep,
The rules, follow the rules.
Yep.
Well, very good. So anything else on that? We got the elections covered, looks
Got it
good.
covered, yep.
So, we'll move along and go through our committee reports.
Okay. That was Dave. Tuesday evening, I was down in Fort Dodge for the regional landfill. Probably the most time was spent talking about the slide that's happening in the south end, where the fill is starting to slide down the hill towards, I think it's Gypsum Creek or something, and they want us to make it, it's sliding at a half-inch a year. It's
How do
gonna
you
cost...
stop the slide?
Well, $2.5 million will stop it, they say. Yeah. But they can do it in stages, they said over several years, so that would help. But they've come up with a couple engineered designs that they figure will stop it. And I thought, really, does it hurt anything? Probably not, but the DNR says you gotta do it. Because I thought, why can't you just keep putting dirt up at the top? Because where's it gonna go? Just at a half inch per year, it's gonna take it a long time, but they say you gotta stop it. So, that was the biggest thing, and then on Wednesday afternoon, I had a Humboldt County Housing meeting. They've been talking about, I'm sure the communities noticed a house they burnt down across from Hy-Vee. They're planning to build a house there for this Project 360, it's a housing program. But we're gonna wait a year, just due to the high cost of lumber and things, it's just not feasible with the market the way it is right now. So, that kinda got tabled.
What do they do with the house?
What's that?
What do they do with the house after you build it?
Well, it's for sale for low to moderate income people. And it's a program, this Housing 360 is really a program for the smaller communities around. It guarantees a house value, and this would be like a display home that they can look at and sell. So.
Is this something that like the high school building trades did?
No,
Involved in,
no,
or-
no, this is a separate program. I mean, we could have them build it, but they got enough stuff planned out. They're always planning in the future,
Mhm.
so they got other things planned out. But it's been kinda tabled until the lumber market kinda stabilizes, 'cause it's just insane right now what stuff costs.
You get an email on the contractor that's coming in this Wednesday and giving us a presentation on his homes.
I didn't get that. I haven't seen it, put it that way.
Wednesday at 3, I think.
Wednesday at 3, okay.
Yeah, 3 o'clock Wednesday.
Yeah.
It's like the one that come in this past week,
Yeah,
another one's coming in,
give us a sales pitch.
give us a sales pitch and tell us what we need to know.
That's it for me.
Okay, Peggy, I left last week early, but I had nothing for the week before. On Monday morning there, I had that, UDMO meeting that I listened to on conference call. On Wednesday, I had the 21st ministerial annual meeting or monthly meeting. Kerry was there, and so we got to ask he told the ministers that he would like to set up the paperwork in order to, in case something ever happened in Humboldt, that they would be able to use each facility as far as feeding or shelter or whatever, if there was a tornado or flood or whatever. So most of the ministers were up for that. Thursday night, CFR meeting on Zoom. Then on Friday, we had the juvenile detention meeting on Zoom also in Eldora. So I think I spent most of my week on the phone.
Anything else, Bruce?
No?
Sandy?
Tuesday the 20th, we had a CCAT daycare meeting. We spent a lot of time trying to figure out where we can save money, how we can get more kids into the facility we're at 63 active children, with 3 of them being part-time. We have 73 total to be enrolled within the next, and most of those are infants, through the next several months. Of course, 10 of those haven't started yet, we just got them on the roll. And they explained a little bit further, because that's the part that I've always been able to, like, I didn't really quite get it, but they have to keep so many areas open down further. As kids get older to a certain age, then they have to move them, into a different role. So that's part of our problem, is you have to keep so many spaces available for when those infants got a bunch coming in, you gotta keep that many bills to be able to move them in. So I think so that's part of the problem, is just trying to figure out how to roll these kids into the next room, but yet keep those rooms full. And so it's kind of a juggling act right now, trying to get that figured out. And then, of course, then it's school-age kids. We're always busier in the summertime than what we are, right now. And we did, DHS did our, we used to be at 50 for school-age, and they have now approved this 30. So that does help. But we're breaking even to, being in the red still. So we're just trying to think of some marketing things we can do and things like that to try to help that along. Wednesday, the 21st, I had a CSS HR go-to meeting that I did, and that again was talking over some of the challenges of hiring people, with everything going on with this pandemic, and mental health has really increased usage, of course, within our services, so things are not, it's only going to get, the longer this goes on, the more people are going to be needing mental health services, and it's just starting to wear on everybody, and of course, not just the people, but of course, the people that are providing those services and things like that. So it's something that we all need to be thinking about, that what can we do to help support the mental health in our area, how can we reach out to people that need help, and to help those that don't really necessarily know that there are services available, to let them know that they are, and how we can help them. And basically, it's just, we need to be each other's support service right now, and to kind of help the way. On Thursday was the CICS meeting to decide whether or not they were going to accept Cerro Gordo, Wright, and Webster into their region. And sad to say, they did accept them in. Webster County has it on their agenda for tomorrow, because their meeting is on Tuesday, to leave our region. We are still holding out hope that Cerro Gordo will not choose to leave, even though they've been accepted now. So we won't know until, I don't know if it's on their agenda yet. I haven't looked. It wasn't on I have been watching their agenda. It wasn't on their agenda as of Friday, so I don't know if they're putting that on today or not. So if they leave, then that kind of that puts us again that we're orphaned. So, because like I said, Cerro Gordo is the bridge to staying in the county social services, and there are a lot of things that county social services does that not all regions do, and because we're we have so many rural counties, we need that because we don't have a lot of providers in our county. So staff does a lot of the work that would normally go to a provider. So like Allison Hauser is our staff person, and she does a lot of individual counseling and help in the facilities that need to get in the facilities, or on that 23-hour hold, have them evaluated. So I guess we're just gonna have to wait and see. That's it.
Right, thank you. Wednesday, I went with the housing meeting in the afternoon up there. And on Friday, had Board of Health meeting. She gave a report on the COVID and stuff that's going on. Sanitation wasn't there, but he signed a letter over of how many wells he's tested and swimming pools and all that stuff. They, did say that they're going to appoint or hire full-time EMTs, which they don't have now, I think, I guess. So, they got all volunteers out there now, so they're gonna try to get a couple that's there all the time. That's what they're working on. That's all I had.
I didn't have any official meetings last week. One got tabled, because there was really no current business on the EMA board. But I just want to give you an update. This past Tuesday, I met with Denise Johnson, met out there with Sheriff Kruger. That is a temporary animal shelter out there west of town. She had some concerns on a little bit of damage when there were some animals housed there. We requested that she itemize her concerns within the next month, so we can get it addressed this year and get those to us, and she was agreeable. So, like I said, Sheriff Kruger and I just looked at her concerns, and she's supposed to be getting us an itemized listing of those.
Okay.
And then, just a quick update on, a work order as it is, on DD5, ditch clean out is moving along. I went out there on Wednesday, just touch base with Brandon Meyer, who's doing that work. And he's come along, he will get it done this year. It's going really well, he's doing a nice job, and he's nearing the finish line on that DD5, but it'll be, well, weather permitting, a couple of weeks or so, but. So just kinda checked on things, that's, no official meetings, that's all I have. Thank you. Nothing? Covered the election, which is good. Keep doing the stellar job that you always do on that.
We will try our best.
Oh, you're doing a great job. Anything else board related now or coming up?
Did you have something you need to talk about that?
Unquestionable, we're not in drainage and not going to be, and we missed public commentary, it's just something.
We can just discuss this
We can
after the meeting.
visit, yeah.
We're all here, and I don't think anybody's gonna run out the door right away, so if that's all right with you? Okay. Given the fact there's no agenda item for that.
Yeah.
So anything else
We'll
from anybody?
make a motion to adjourn then.
Second.
Bruce, all those in favor?
Aye.
Opposed? We